Hello, my name is Dr. Paul Choi. I am the Director of Endoscopy at the Los Angeles Endoscopy Center, and I'm also a fellow member of American Gastro-Enterological Association. In this video, I'll be discussing Gastro-Esophageal Reflux Disease, commonly known as GERD. GERD is a very common disorder. It is thought that up to 10% of adult population suffer from the symptoms of GERD at one point in their lives. It is thought that obesity and our dietary habits are important factors affecting the increasing incidence of GERD around us. Often, patients who have symptoms of GERD complain of heartburn, burning sensation in your heart. Some patients complain of indigestion or dyspepsia, acid regurgitation, sore throat, cough, and even asthma. It is important that you realize that symptoms of GERD often can mimic the heart condition such as angina. Therefore, if you have other risk factors such as family history, smoking history, high blood pressure, diabetes, that you make sure that the symptoms that you think of GERD is not from your heart. When we eat, we swallow food into the esophagus and it passes through a sphincter called lower esophageal sphincter. And through the sphincter, the food goes down into the stomach. When this sphincter does not function properly, the food content, as well as the acid and digestive enzyme in the stomach, backs up and reflux into the esophagus. When this happens, it can cause inflammation and the symptoms that we have described. To make the accurate diagnosis of GERD, it is important that we review the history. History can tell you whether this is likely to be a GERD in most cases. However, if you have other risk factors for heart condition, as I mentioned, it is important that you make sure that this is not coming from the heart. Additionally, if the symptoms of GERD persist or do not respond to medical therapy, then you undergo upper endoscopy examination to make sure that this is indeed GERD and there are no other confounding variables such as pre-malignant conditions such as Barrett's esophagus and even cancer of the esophagus. The treatment of GERD often consists of dietary as well as medical therapy. As far as dietary management is concerned, it is important that one reduce the weight if a person is overweight. Because when you're obese, the abdominal pressure increases and the sphincter of the lower esophageal region the pressure tends to be low and promotes the reflux of the gastric stomach content into the esophagus. To do so, it is important that you exercise and reduce the size of your meal so that the stomach, when you eat, does not overflow with food, which can happen when you really stuff your stomach with, let's say, a large dinner. Additionally, we recommend that you stop smoking and drinking, both of which can affect your lower esophageal sphincter, and reduce the food from your dietary habit that can reduce the sphincter tone of the esophagus, such as tomato, peppermint, onion, chocolate, and greasy food. If these measures do not work, you can also try elevating the head of the bed up to 30 degrees at night to lessen the reflux by elevating your head up from the level of your stomach. As far as medical therapy is concerned, we recommend that you try over-the-counter antacids such as Tums or Mylanta to neutralize the acid in your stomach as an initial therapy. If this does not work, then one can also try acid suppressants such as Zantac or Prilosec, both of which can reduce the amount of acid content in your stomach. If these measures do not prove to be effective, then you should, as I mentioned, make sure that there are no other confounding variables by undergoing upper endoscopy examination. GERD is a very common disorder. We can often effectively treat this disorder by simple dietary and lifestyle modification. If, however, these simple measures do not work and conventional medical treatment do not seem to be effective, then we recommend that you see a specialist to make sure that it is indeed GERD and that adequate and effective therapy can be provided. I hope I have been able to provide you with a brief summary of the symptoms and pathogenesis as well as a treatment of very important disorder called Gastro-Esophageal Reflux Disease. Thank you for listening.